My name is Ephraim. I'm going to be your nurse taking care of you today, okay? Can you please tell me your name and date of birth?
Heidi Squarzitsky, 626 of
All right, I'll just check your identification. All right. And can you tell me what you're in the hospital for today?
Well, I guess it's really a lot of things. I feel like I just have no energy lately, and I've been feeling just really down. I tried playing catch with my son this morning, and I could only be out there for about 10 minutes before I got too tired. I feel like I've been putting on a lot of weight, and I haven't been able to go to the bathroom. I've been really constipated. And on top of all that, my hair is falling out, and I just can't seem to get warm. I'm always cold.
Oh, I'm so sorry to hear that. Okay, we'll just go ahead. I will do a head-to-toe assessment of you, okay?
Hypothyroidism is a big fancy word for an underactive thyroid. The thyroid is a butterfly-shaped gland that resides in your neck and plays a major role in homeostasis and metabolism, which refers to all the chemical reactions that occur in the body. In hypothyroidism, the thyroid gland is producing inadequate amounts of T3 and T4 hormones for the body's functioning. T3 and T4 play a part in nearly every metabolical action in your body, and your metabolism is essentially controlled by the thyroid gland. And if it's not producing enough hormones, it results in a slowed metabolism. So, high levels of T3 and T4 cause an increase in metabolism, and low levels of T3 and T4 cause a decrease in metabolism. Some of these metabolical reactions relate to weight regulation, body temperature, organ function, and chemical conversion pathways. We will see some of these manifestations and how a nurse might assess them in our patient Heidi.
Alrighty. So, okay, I'm just going to begin my assessment now. So I'm first going to be assessing your skin, face, and nails, okay? I'm gonna look at your nails, see if there's any brittle nails, okay? I'm also going to be checking your hair as well. You said that you were experiencing some hair loss. All right, yes, I do see some spots open, okay? All right, let me take note of that over here in my chart. Alrighty, okay, and I'm also gonna ask you a couple questions, okay? So can you tell me what city you were born in?
Eau Claire, Wisconsin.
Okay, and what did you have for breakfast?
I can't remember.
Oh, okay. All right, so I will take note of that as well, okay? And I see that you have a blanket on. It's kind of warm in this room, so are you cold?
Yeah, like I said, I can't seem to get warm lately.
Okay. Okay, yeah, and you said that you were feeling a little tired as well too,
Yep.
so I'm sorry about that. All right, I'm also just going to be checking your upper and lower extremities as well, okay? So can I just roll these sleeves up here? Thank you. All right, when I'm checking your upper extremities, I'm checking for any edema, okay? So there's no edema present. I'm going to go ahead and now check your lower extremities. Have you had any problems at all?
I've noticed some weight gain, and they seem like they're swelling a little bit.
Yeah, I do see a little swelling here right now. Okay, so let me have that here. All right, and I do see kind of like a yellowish tint, yellow-orangish kind of tint. Okay, so when did you first see that? When was that
I
first?
think that was about a week ago. I wasn't sure why that was happening, but my husband noticed.
Okay. All right, I'm also just going to open your mouth as well, okay? And I'm going to be assessing your vocal folds. All right, with my pen light here. All right, seems your vocal folds are a little swollen too, so that is something to be worried about. But do you have any hoarseness at all when you talk? You feel like your throat's kind of scratchy?
A little bit.
Okay. I'm going to be checking your thyroid, okay? Seeing if there's any inflammation. So I do feel a little inflammation here, okay? All right, so I will take note of that as well. I was wondering if you could sit on the side of the bed. I'm going to check your reflexes as well as checking your gait. All right, so first I'm going to check those reflexes, okay? Okay, and here we go. 1, 2, 3. Nothing. 1, 2, 3. Nothing. Okay. All right, now do you need some help standing up? We're going to be checking your gait to see if you're able to walk. Okay, all right, so you're going to just be taking 10 steps going forward and then 10 steps back, heel to toe. All right, looking for any imbalance. And do you feel dizzy at all while you're walking?
A little bit. It's kind of hard.
It's hard to walk a little bit. Okay, all right, so we'll just take a seat right here. I'm going to just do a blood draw, okay? I'm going to be getting labs known as TSH, T4, and T3, okay?
Okay.
All right, so I'm just gonna go ahead and draw some blood from you. Ooh, nice vein right there. Alrighty. Alright, so now my assessment is complete and I have drawn blood and I have sent that over to lab. I will notify the provider immediately.
When assessing a patient with hypothyroidism, there are many things that the nurse should pay close attention to. The patient's overall appearance can give an indication of hypothyroidism. This is because their skin becomes a yellow-orange tint due to reduction of keratin in the body from lack of chemical conversions. The patient can also have puffiness in the face because of the accumulation of sodium in water. Also with hypothyroidism, the patient may have brittle or dry nails and hair. While assessing, the nurse may take note of myxedemia, which is in severe cases of hypothyroidism. It can include dry skin as well as swelling of the underlying tissues and skin. The patient will also have a hoarse voice, so the nurse will need to assess their mouth by asking the patient to open their mouth and looking at their lymph nodes, which may be an indication of laryngitis as well from the inflammation of their thyroid. The nurse can also perform a general assessment to assess for lethargy and fatigue based on how the patient is presenting themselves, just by observing them as the assessment is being performed. Another key assessment the nurse should perform is a neurofunction assessment, because with hypothyroidism, the brain can go through memory deficits, making it harder for the patient to recall things, as well as having a shorter attention span. The patient may also feel cold because they have built up an intolerance to cold, causing them to shiver even when the room temperature is comfortable for the others in the room. Finally, the nurse should be aware of what low thyroid can do to the gait. Although gait isn't affected by hypothyroidism itself, there are other underlying health conditions that, because of hypothyroidism, lead to an unsteady gait. For example, in a study done in 2016, research shows that myopathy and bone degeneration can be caused by hypothyroidism, leading to more fractures and falls because the patient would have an unsteady gait. So the nurse should request for the patient to walk from heel to toe to carefully assess their gait.
Hi, Dr. Olson. How are you?
I'm good. How are you?
I'm doing well. I was just in with the patient in room 12, and after I did my assessment and what she's told me, she said that she doesn't have any energy when she's playing with her son outside. She says maybe 10 minutes, so that's really just about all the energy that she has. I also assessed her head, her hair, and there was a lot of balding, so I'm not sure what's going on with that. Okay, and her skin was very dry and she was feeling very cold, and this room is fairly warm, okay? So I just wanted to bring all this to your attention, and she would also say that she gained weight recently, so I was kind of worried about that, so I just wanted to notify you of that and see what your next steps would be. But I think maybe hypothyroidism.
Yeah, well, Ephraim, I'm glad you brought that up, because I actually did just receive her lab results, and as you can see from her lab results, her TSH is severely elevated and her T3 and T4 levels are very, very low. And based on the symptoms that you're describing, it does sound like she has hypothyroidism.
Oh my goodness.
Hello.
Hi.
Heidi, I'm going to be your nurse today.
Okay.
I'm just coming in and I see that we have some new lab results.
Okay.
So your TSH levels are really high and your T3 and T4 levels are really low. So those are hormones made by your thyroid. So it means that you are likely suffering from hypothyroidism. I have some pamphlets here for you explaining what that is.
Okay.
Do you have any immediate questions for me?
What is hypothyroidism? How did I get hypothyroidism?
Yeah.
Sorry.
Of course. So it's it's a different etiology for everyone, or a different cause for everyone. So a lot of times in developing countries, sometimes they have deficient iodine in their diets, and that is a leading cause for hypothyroidism around the world because iodine is needed to make those hormones T3 and T4. Other cases, which here in the US, a leading cause is something called Hashimoto's disease. It's also called lymphocytic thyroiditis. It's where your body makes antibodies or things that attack your thyroid. So it causes dysfunction in your thyroid. There are risk factors for this as well, being over 50 years old, being a female gender, having any previous radiation can cause this, or certain medications such as amiodarone or lithium, as well as some seizure medications. These can cause thyroid dysfunction. So we'll do a full medication regimen. We'll see previous exposures to anything, and we'll get to the bottom of what caused this.
Okay. All right. Well, thank you for that information. I do have one question. So I was told I was prescribed levothyroxine.
Yeah.
Do I have to take that?
Yeah, so it's really good that you're taking your medication for your hypothyroidism. Without taking that, you are missing the hormones that are helping you sustain all the functions of your body. So without taking those, you could develop really slow heart rate and respiratory rate,
You get very cold and you probably see some altered levels of consciousness. So you would definitely want to come in. What that's called is a myxedemia coma. So that means that you're having very low levels of your thyroid. So you want to take your medications.
Oh, jeez. The impact that hypothyroidism has on the body includes LDLs, which is bad cholesterol. These receptors in the body decrease the liver, and over time, there are going to be fewer liver receptors in the LDLs. This causes less metabolism and excretion of LDLs. Because the body isn't properly excreting the LDLs, it can eventually lead to atherosclerosis. Something else the nurse should be aware of is that with hypothyroidism, you can have low thyroid levels and the patient is at risk for other health conditions. This can include the patient experiencing anemia, which is decreased hemoptysis. They can also experience a decreased kidney function, which in turn will cause a decreased clearance of medication and a higher likelihood of the patient experiencing drug toxicity. Over time, more fatal conditions can occur like hypercapnia and hypoxia due to alterations in the pulmonary system. They can also experience cardiomegaly. Symptoms the nurse could monitor for include chest pain and severe shortness of breath, as well as radiating pain that can be felt throughout the arms, legs, jaws, and stomach.
Hey guys, I just wanted to congratulate you on your first day on the job here at the hospital.
Thank you.
You're welcome. Since it's the holidays, we're just going around and doing a little pop quiz to win some prizes if you're interested.
Oh yeah, of course.
Great, okay. So my first question for you is a knowledge-based question. It says, a nurse is caring for a very lethargic female patient in the emergency room. The patient's face appears puffy with an orange tint, and she complains of feeling cold. The patient's lab values came back, and they showed an increased thyroxine-stimulating hormone and low T3 and T4 levels. Which diagnosis would you anticipate based on these findings? A, primary hypothyroidism, B, primary hyperthyroidism, C, Graves' disease, or D, cirrhosis?
So I think going back, maybe primary hyperthyroidism.
Yeah.
Hypothyroidism.
Final answer?
That's my final answer.
Yes, that is correct. A nurse is providing education to a patient prior to discharge. Which statement indicates a patient's understanding of her new hypothyroidism diagnosis? A, I should eat foods high in good LDL cholesterol to decrease my cholesterol levels. B, once my symptoms subside, I can stop taking my medication after talking with my provider. C, I can continue taking my medications if I become pregnant. Or D, it is important that I manage my hypothyroidism so that I do not develop Graves' disease.
I think that the answer might be B. Once my symptoms subside, I can stop taking my medication after talking with the provider.
Yeah, because shouldn't they just be able to get the hormones and then they should be okay?
Yeah. So actually, that is incorrect. A patient is put on hormone therapy because they have an underactive thyroid, and they have to stay on that therapy in order for their thyroid to continue to secrete those hormones that they were missing previously. So if a patient abruptly stops their medication, all of the side effects of hypothyroidism will come back, and if it's not treated, it can get significantly worse. And try again.
Let's see. Must be able to take it when they become pregnant.
Right?
Yeah, yep, so that is the correct answer. And Graves' disease is more associated, it's an autoimmune disease, and that's associated with hyperthyroidism rather than hypothyroidism. So, but yes, if a woman becomes pregnant, she can continue to take her levothyroxine medication. And it's also important for pregnant women to have their thyroid hormones checked because pregnancy can also affect and lower those even further. It's important to continue the medication and keep on it.
Okay, that is good information to know.
Yeah, a little good refresher.
Yes, thank you for that.
You're welcome.
Thank you.
Right.
See you tomorrow.
Yup.